16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
The journey from illness to wellness can be a challenging one, but definitely not impossible. Good evening, viewers. Welcome to today's episode of KIMSHEALTH Doctor Live. This is an exclusive health talk with health experts talking to us and giving us advices on different health conditions. Myself, Marina Francis, your host. A lot of health problems around the world these days are caused due to inactive lifestyle and unhealthy diet. And in today's episode of Doctor Live, we have taken up the topic obesity and diabetes, two common health concerns around the world. So we will be talking about what causes them and most importantly how we can prevent them. And I'm very happy to introduce to you the doctor joining with us today, Dr. Sanjay Naidu. He is a consultant in endocrinology, currently working at KIMSHEALTH Hospital, Al Hassan branch. He has an experience of over 25 years treating patients with diabetes, thyroid, obesity and PCOS. It's my pleasure to welcome Doctor to today's Doctor Live. Good evening, Doctor.
Good evening.
Welcome to the show.
Thank you.
So, Doctor, we have taken up the topic obesity as well as diabetes. So, let me start with obesity. In your opinion, how common is obesity these days?
Obesity is a very common illness nowadays. Actually, there is an epidemic of obesity going on all over the world, and especially in Bahrain. almost 30% of the men and 40% of the females, adult females, are having obesity. And you measure obesity by doing the height and the weight giving rise to BMI, and anything more than 30 is obese, anything more than 40 is severe obesity.
So doctor, my next query would be, can obesity shorten the lifespan?
Obesity definitely is a very bad illness and it can shorten the lifespan. If you have got moderate obesity, that is BMI more than 30, the life expectancy goes down by almost 3 years, and if you have got severe obesity, you can shorten your lifespan by almost 10 years. And the main cause of death or mortality in obesity is because of heart disease, heart attacks, brain attacks, respiratory problems and cancers.
So doctor, can obesity be cured?
Right, that is a very good question. Obesity cannot be cured, but it can be controlled. With lifestyle measures like diet and a good exercise, you can control your obesity, but there are many medicines available which are not very effective. The latest modality of treatment of obesity or cure of obesity is bariatric surgery, in which you shorten the stomach, and so that you can lose weight, almost 20 to 30 kilos you can lose in a month.
So doctor, that was about obesity. Moving on to diabetes, can you elaborate what is diabetes and how do we treat diabetes?
Right, diabetes is a chronic condition in which the blood sugars are very high. This happens because of less insulin. And coming to the treatment of diabetes, it is lifestyle measures, diet, exercise and medicines.
Doctor, we spoke about obesity as well. So how is obesity linked to diabetes?
Right, obesity is the cause of diabetes. If you are obese, you put on weight, you are more prone to become diabetic, and if you have got genetic predisposition to diabetes, you definitely will get diabetes. Almost 20% of the Bahraini adult people are diabetic.
So doctor, to treat obesity, what are the lifestyle changes that we have to adopt and what is the treatment procedure?
To control obesity, the lifestyle measures which we should do is diet and exercise. Diet, a person should take diet intermittently. Like I was telling you, they should have proper meals, low calorie meals, but at right times. Multiple small meals should be taken, and a good dietitian should be consulted before that. And exercise, they say walking, running, but I think the walking at least 45 minutes per day, at least 4 to 5 times a week is the best form of exercise a person can do. This the person can keep on doing with just a good pair of shoes, and this, by these two methods, nowadays yoga and many more modalities are coming up which help you in controlling diabetes.
So definitely that makes diabetes a very important topic to discuss about, but we will discuss further about diabetes, but we need to take a short break now. We will be back after a very short break. Welcome back. You're watching KIMSHEALTH Doctor Live. Today's episode is on the topic obesity and diabetes, and with us is Dr. Sanjay Naidu. So doctor, next I would like to ask you, what are the health problems faced by diabetics?
Because of diabetes, as chronic hyperglycemia affects all the systems of the body, mainly it gives rise to acute and chronic complications. Acute complications are when the blood sugars are very high. Because of high blood sugars, you must have heard of diabetic coma, diabetic ketoacidosis. That is the acute complication. Sometimes because of long standing diabetes staying for 10 to 15 years, you can have chronic complications. Of the eyes, you must have heard of the commonest cause of blindness is diabetes. It also affects the kidneys. The commonest cause of kidney failure is again diabetes. Diabetes can affect your peripheral nerves, you can have heart attacks in diabetes, you can have brain attacks in diabetes, and many times you can have a diabetic foot. Even sexual problems are common in diabetes.
So definitely I think the most important question is how can we prevent diabetes?
This is a very good question. It is the prevention, we all know, is better than cure. So if you can prevent diabetes, nothing like it. The best modality of prevention is lifestyle measures. If you can eat less, walk more, control your weight, not become obese, you will not get diabetes. And suppose you are at very high risk of diabetes, there are some medicines also which you can take to prevent diabetes.
So doctor, is diabetes completely curable or reversible?
I can to this question I can say yes or no. It is curable also, and many times is not curable also. Suppose you are very fat, so suppose you are very obese, 80 kilos, 90 kilos, if you lose 20 to 30 kilos of your weight, you may cure diabetes, but as long as you do not put on weight. The moment you put on weight, diabetes comes back. The best modality of cure of diabetes, as I was saying, is bariatric surgery, in which the condition in which the surgery is done to make your stomach very small. So even you get satisfied with your food with a cup of milk or something. So you can lose 20-30 kilos in a month or so, and this is the only modality which is known to cure diabetes.
So doctor, you mentioned about the hereditary aspect of diabetes. So can we say that diabetes is a genetic disease?
Yes, to some extent diabetes is a genetic disease. Many times we get patients with diabetes, especially type 2 diabetes, and on asking they will tell you that almost all members of the family, the grandfather, the father, the uncles and cousins and brothers, all have got diabetes. So it is a very much a genetic disease.
So we heard that hereditary is one of the causes of diabetes. What are all the other causes of diabetes?
All the other causes which make you put on weight because of the lifestyle measures, problems like putting on weight because of less exercise, no walking, urbanization, eating more. Nowadays you have heard of hamburger cola culture. People are eating burgers, having Pepsi, Coke, and this causes weight gain. The moment you have weight gain with genetic factors, both combined together, you get diabetes. They say that people of especially Indian origin, when they are staying in India and not getting so much food and not getting so much luxury, the moment they visit countries like Bahrain and all, where they get urbanization, good food, and they start getting diabetic. So this is so poor genes along with environmental insult of poor lifestyle measures, you get diabetes.
So doctor, to identify diabetes, what are the symptoms that we should look for?
First of all, excess urination. The patient will tell you that the patient is going to the toilet a number of times, every hour, every half an hour, then drinking a lot of water and getting very hungry. In spite of all this, the patient loses weight. The patient will give you the history that he has lost about 10 to 15 kilos of weight, and sometimes a patient can have a wound on the body anywhere, not healing for a long time, and many a times the patient may not have diabetes but present straight with heart attacks, brain attacks, and then come to know that he is a diabetic.
So doctor, to diagnose diabetes we do blood tests. So what are the natural sugar levels in our blood that is supposed to be there?
So you want to know what are the normal blood sugar levels. They say that a post meal blood sugar more than 200 is diabetes. Blood sugar anywhere between 140 to 200 is pre-diabetes, and there is a new modality of testing nowadays that is known as glycosylated hemoglobin. It shows the 3 monthly blood sugar control, and if it is more than 7, you are having diabetes. So by these three methods, a fasting blood sugar, a post meal blood sugar and a HbA1c, you can come to know you are diabetic or not.
Doctor, in your opinion, how frequently should we visit a doctor?
Suppose you become a diabetic, I think the best is every monthly you should visit your doctor, and once the blood sugar levels come under control, your BP comes under control, you can visit your doctor once in 3 months.
Doctor, I would like to know what are the different types of diabetes and how they are different. Can you elaborate on that?
Right, that's a good question. Diabetes basically two types. Type 1 diabetes, which occurs in children, and in this diabetes there is no insulin at all, and this is also known as juvenile diabetes, and in which the patient has no insulin and suddenly becomes very serious, and from day 1 you have to give the patient insulin, and whole life the patient has to be on insulin. And this is a but this is a bit rare type of diabetes. The second diabetes which is more commonly seen in population is type 2 diabetes, that is adult onset diabetes, also known as maturity diabetes. Here almost 98% of the population who come to us are of this type of diabetes. There is one more diabetes, that is gestational diabetes, that is diabetes first diagnosed in pregnancy, and there are all the other diabetes come under secondary diabetes, but the most common diabetes which we see in practice is type 2 diabetes.
So doctor, for diabetics, in your opinion, what's the kind of diet that they have to follow?
Right. In type C especially, sugars are not allowed. Once you become a diabetic, you are not supposed to take anything sugary, but you have to take regular meals at regular times, not to miss meals, and they say this chapatis are better. You have to take breakfast, lunch, dinner, and along with that almost every 3-4 hours you have to eat something. Usually in Indian population, they will say they will have breakfast, morning brunch and dinner. That is not possible. You have to eat multiple meals and in small amounts, and not to miss a meal, because once you start a treatment and if you do not eat your food, your sugars can go low because of your medicines.
So doctor, when you spoke about that, apart from diabetes, there is this problem of sugar levels going very low. How to tackle that? What is your...
Right, that is a very good question. The most dangerous complication when you are treating diabetes is low sugars. With high sugars, the patient will come and tell you, doctor, my sugar is high, what to do, or you are not treating me properly. But when the sugars go low, he will come in an ambulance, and that will be very dangerous. So you have to tell the patient that when he is taking treatment to regularly monitor his blood sugars. All the patients are nowadays supposed to take a glucometer and keep it with them and keep on measuring themselves how much the blood sugar is, and the moment they feel that the blood sugar is going down, they are supposed to take sugar. At this time when the sugars are going low, suppose on the glucometer it is showing 50, they can take plenty of sugar, not a half a teaspoon, they can take 3 to 4 teaspoons, a bottle of Coke or a nice tea with biscuits with full of sugar. But once the sugar becomes normal, they again have to stick to a non-sugary and normal diet.
Doctor, diabetes during pregnancy time, how to handle that?
Pregnancy and diabetes is a very complicated topic. Basically, many times what happens, the lady is already a diabetic and then she becomes pregnant. That is pregnancy, type 2 diabetes or type 1 diabetes with pregnancy. There is something known as gestational diabetes. The lady does not know that she is a diabetic and then she becomes pregnant. That is gestational diabetes. But the previous one, in which the patient is already knowing that she is a diabetic and then she becomes pregnant, we have to be very careful. And the best treatment here is insulin. The moment the patient decides to have a child, she has to be on insulin, and we have to maintain the blood sugars almost 100 to 120 so that the blood sugars are maintained. Suppose the blood sugars are high, the child in the stomach, in the womb will have genetic problems, some genetic transformation, so the sugars have to be maintained. And the second thing is gestational diabetes and pregnancy. Here once the patient becomes pregnant, after some time she becomes diabetic, so here the treatment is insulin, but you do not have to be very strict with it.
So what could be the risk factors associated with having diabetes during pregnancy time?
The risk factors are in mother and in the child also. In the mother, because of poor glycemic control, she can have diabetic ketoacidosis, infection and other problems, kidney problems, eye problems. But if the blood sugar is not well controlled, like I was telling you, if the mother is diabetic before conceiving, the child can have congenital malformations, and he is born, he will not be normal, the child will not survive. And in gestational diabetes, if the sugars are not well controlled, the child will be very big. You must have heard of people saying that my child was 4 kilos, 5 kilos. Big size child is usually seen in diabetic mothers.
So doctor, as we come towards the end of the episode, can you sum up all of this into a takeaway message for our viewers?
Basically, these diabetes and obesity are lifestyle measures. Obesity is the problem, presently an epidemic all over the world. Initially we were having malnutrition, starvation, but now with things getting better, people are getting more and more obese, and because of obesity it lands to diabetes and hypertension. So my take home message is eat less, walk more to have a healthy and a fit life.
Thank you very much, doctor, for joining with us today and answering to all our queries. Definitely the viewers would have found this episode quite useful, relevant and informative. We will be back again next week, same day, same time. Until then, this is Marina Francis signing off. Stay healthy and stay happy. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.